Bob Richter is a lieutenant commander in the United States Navy Medical Corps. He is in charge of the Navy's surgical team at Roc Ya in South Vietnam. 35 years old, unmarried, Northwestern Medical School, specialist in orthopedic surgery. Jerry Grant, volunteer surgeon from New York, married, 3 children, specialist in urology. Jerry Hassika, lieutenant junior grade, team anesthetist. Dennis Renander, hospital corpsman 3rd class, laboratory and x-ray technician. Their job is to give medical aid to the nearly 2.5 million people in the province of Kenyang.
How old is he? About 5, 7? I always guessed too young.
Yeah.
The medical team has been here for only 3 years. But this man's people have been here for 5,000. They have seen kings and emperors, dictators and tyrants. But it is the land that supports his home, feeds his family, and protects his ancestors. So it is to the land that he remains faithful. Time has passed over this place, but left no mark. This peasant still cuts rice with the same knife that those before him used. And when he dies, this land will go to his children. But for all their history, sickness has plagued these people. Half of them die before they're 15. They have no knowledge or understanding of sanitation or modern medicine. They have lived in the superstitious darkness of witch doctors and medicine men. The marketplace of Roc Ya. Every day people come from the surrounding areas to trade goods and gossip. In little stalls by the edge of the canal, they buy and sell, talk and barter. Shrimp, eel, fish, pork, lettuce and rice. No one starves in this province, but the food they eat carries the germs of disease, typhus, typhoid, worms and dysentery. For the past 5,000 years, the situation has remained unaltered, and the only answer was archaic witchcraft, herbs, potions, and incantations. This is a crowded place. The sewers are uncovered like those of Europe in the Dark Ages. There is little plumbing, and the people throw garbage into the streets. Soap is a luxury for the rich. Only within the past 30 years has any real effort been made to improve their primitive conditions. Just before World War II, the French built a province hospital in Roc Ya. Today, its stucco walls and lush courtyards offer a small degree of solace to the sick. It is administered by 2 Vietnamese doctors who received an elementary training in Saigon. The hospital has only 400 beds to serve 2.5 million people. By most Western standards, it is hopelessly inadequate. Only recently has there been a significant change. The old ideas are giving way to the new. The Navy team uses 4 Vietnamese interpreters, whose grasp of English is as limited as our knowledge of Vietnamese. Ba is Mrs., Um is Mr., Ko is Miss, M is child. You learn a little Vietnamese, but never enough. So you end up speaking in simple, halting sentences.
I never use in America.
Why?
Because in America we not use alcohol. Never heard of it before. This comes from in France.
Oh, yes.
France they used to use alcohol all the time, put on hands. And you know a professor? Professor? Mr. Rockwell, professor?
Professor.
Yeah, I know professor.
Professor? Yeah, well he number one, and his younger men walk around, carry the alcohol bottle, put on hand.
Yeah.
That's why you still have alcohol here today.
But how do you explain anatomy, surgery, or hygiene? It takes a long time, but it can be done.
This is a man in bullets go right through leg, but not break the bone.
Every day, Bob Richter makes his rounds. He examines his patients, instructs the Vietnamese nurses, and builds a trust that never before existed.
It's still very sore, but it looked clean. No infection.
Nó còn sưng ha, nó còn đau nhưng mà không sao, vì nó không có làm độc đó ha.
He got shot here, and he went to another hospital, and they thought they were going to have to amputate his arm. But, so he came back down here to see us. He has an injury to the nerve, to these two fingers, the ulnar nerve, right?
Bị thương làm cái gân ha, bị thương là cái tay hai ngón này tự động không nhúc không được.
And also the bullet break these bones.
Yeah.
Now, when the bone heals, the tendons stick to the bone, so you cannot pull the finger down.
Yeah.
So maybe we can free up the scar, get rid of scar, then tendons work again.
Yeah. Bữa trước là gãy xương ha, bây giờ cái xương nó lành lại rồi nó dính luôn cái gân luôn đó đó.
The men in this ward have been wounded fighting the Viet Cong. Their sacrifice is tangible and painful. No herbs or potions, no witchcraft can ease their suffering. But modern medicine, the skill of a surgeon's hand, and the compassion of one man for another can.
That would be the very worst thing. You know, if we could do nothing else, we could put these fingers in good position.
Từ trường hợp phải làm tất cả mọi phương tiện mà không được ha, bác sĩ phải làm cái tay như vậy này ha, hai ngón này đó, để có thể để cầm giật gì bên đây cho mình nắm mới được, ha, không có đau. Đây là cái mức trong cái việc làm sau cùng đó, lấy ra bác sĩ ra, giữ ra.
Oh, like this.
Này, có người.
You have all good muscle up above.
Yeah. Tốt lắm, cái tay không có gì hết trơn, có cái gân thôi à.
You know, amputate that.
Chứ không bao giờ cắt đâu, không bao giờ cắt ra đâu.
Clinics are held once or twice a week in the hospital. People come from all over the Mekong Delta because they have heard of the American doctors. It's a long and difficult journey for some. They come by foot or bicycle, by sampan or water buffalo. But they come.
How's the little boy feel?
Chị thấy nó thế nào? Thấy nó cho mình khỏe không?
Khỏe.
Yes, she feels. She will fly a little bit better.
Feel better? There we go. Look at that. No cry.
Không có khóc nghe, tốt lắm nghe chị.
Very good little boy.
Tốt lắm rồi.
Let's have a little dressing put on
Yes,
in
okay.
emergency
Yes,
room. Okay.
yeah.
And have him come back just one more time.
Dạ,
2 weeks.
bây giờ chị em bồng em bên trước nha, đợi lấy giấy nha. Bồng em bên trước phòng của cấp này cái nói cái thầy nó băng lên chân em rồi 2 tuần nữa trở lại.
Okay?
Dạ. Dạ bác sĩ. Tôi ra đây xin bác sĩ đi dạ.
Bye.
Chào cô, dạ.
Next.
Cho vô em ơi.
Good afternoon.
Ngồi đi em cô.
You want to sit down here?
Ngồi ghế này. Ngồi ghế không có được.
You can sit on the chair. He does not want to sit on chair.
Bảo nó ngồi ghế đây mà. Không có được rồi đó.
Why doesn't
Không có sao đâu bác cứ ngồi đi.
Bác.
he did not want to sit on chair?
No, sir, he respect.
He what?
He respect you.
He respect me. Oh, I see. So he did not want to sit next to me?
Yeah.
Oh. Would you ask him what his trouble is?
Bây giờ bác thấy cho mình như thế nào?
Dạ cho mình đi làm nhưng mà có cơn không?
Có cơn gì?
Làm như còn em có khi tiền bạc chưa không biết đâu, không biết nó tại sao nó phím.
He thought sometimes he feel the blue mind.
He feels what?
Lost mind.
He lost his mind.
Dạ, khi đông nói thì
He doesn't feel he knows anything anymore. How old is he?
nè, đến đi. Khi nào câu hỏi bác nói mà câu hỏi cho bác đừng nói nha.
73?
73.
Yeah.
He doesn't know remember.
He doesn't remember. Oh, I see. Well, he was sent here by Dr.
Dr.
John?
John, yeah, Vietnamese doctor.
Right. With a diagnosis of tumor. Ask him, does he have any pain in his
Có
face?
đau không? Dạ, không có đâu, không thấy đau. No pain. Nó lúc trong này nè.
No pain.
Còn cũng phải lớn. Đến đây khi nào câu hỏi bác nói. He talked last week, he feel much pain, but now he feel better.
I see. But this is what bothers him right here, is in the right side of his neck. Yes. Well, he has either a very hard node there, lymph node, which is growing because of tumor or because of infection. But I think it probably tumored.
Có lẽ là có một bú ở trong gõ bên em.
We are
Có thể là nó nhiễm nó độc ở trong đó.
have a head and neck doctor come to Long Swin in about a week. And in the meantime, I'd like to give him some aspirins for his pain, and then have him come back in 1 week. And when we hear about ear, nose, and throat or head and neck doctor, we can send him to Long Swin for further treatment.
Here, Mr. Dome, we have some Ascaris eggs. This is a large
Mr. Dome is in charge of the hospital's laboratory.
large round.
He has never taken a course in biology or chemistry. Yet he is responsible for making accurate diagnoses of specimens sent to him by the hospital doctors. Everything he knows about laboratory procedures was taught to him by his Navy counterpart, Dennis Renander.
There are 2 or 3 eggs of this kind.
The schools in Saigon, Hue, and Da Nang are overcrowded, so technicians and nurses have to be trained on the job. It's a slow process. Mistakes are made, corrected, but soon he will have acquired sufficient skill to handle the job alone.
Did you see it? Ông biết rồi? Ông biết rồi.
Most of us regard operations as something to avoid, and after it's over, something to talk about. To a doctor, it's his life, a vocation to be learned, practiced, and perfected.
That part.
Suction?
Mr. Day has been trained by Americans to be a surgical technician. Although he is not a doctor, he is qualified to perform all but the most sophisticated operations without supervision.
Side, please. Let's have the suture ligature.
To most Vietnamese, an operation is alien and mysterious. A ritual behind closed doors, carried out with small knives, bottles, tubes, and needles. But in the eyes of the Vietnamese, it is different from the medicine man's magic, because the cure is real and not imagined. They know that an operation can save a life, restore a body, and relieve pain. Still, it is a time of uncertain waiting for the families. Entire households move into the hospital corridors, leaving their work and their homes, coming here, so that the family will remain together. After an operation, the patient must return for periodic checkups. This is new to them, something they have never done before.
Mr. Y, you tell him he is only 4 weeks from his operation now, and that this take time for pain to go away. I think that he is doing very well, and these bones are all right.
Yeah.
So now what he should do is every day he should wash his hand in water, good, get the dirt off.
Yeah.
And that he should practice exercising his finger any time of day. Practice bending his little finger down. Tell him try to get his little finger down to touch.
Yeah. Bây giờ hai bác sĩ nó làm kia, còn không đau thì thôi.
Không đau đủ.
Yeah, okay.
Thấy từ giá.
Yeah. You know, Navy not supposed to salute without hat on, but I like to pay them compliment. Chào bà.
Bác sĩ chào bà.
Dạ.
Looks like your cast is pretty well gone. Let's see. Yeah. Multiple wounds of body. I don't remember this lady. New short leg cast, 6'3". How's she feeling?
Bữa nay thấy sao?
All wars claim innocent victims, and this is especially true in Vietnam, where terrorism is a common tool of persuasion and intimidation. This woman was riding a bus jammed with people coming home from work when a mine exploded beneath it. 27 people were aboard. The survivors were rushed to the hospital where the doctors and nurses worked for a night and a day to save them. 20 of them survived, but of these, only 5 will ever walk again. She was one of the lucky ones. She escaped with only a broken leg and an injured back.
She said she lived very far from our city.
She lived very far.
Yeah.
Well, you tell her we go very fast and we see what we have to do for her.
Yeah. Giờ đưa qua bển chụp hình cái xương sống coi nó có sao mà đau nha, viết các cái băng bột chụp hình lại nha, rồi mời ra trước.
Bây giờ chụp ở đâu nữa?
Đi ra trước hỏi nha, trước là chỉ dẫn rõ thêm ha.
Yeah, okay, bà.
Em đây bác sĩ chào em. Bác sĩ chào em đó em.
What's the matter with you?
Sao đau sao? Em sao?
Té cho má rồi gãi tay rồi thầy cũng nam tăng liền mà giờ nó còn kẹo.
Còn kẹo lên ha. She said before this boy fell down by bicycle accident.
Yeah.
And Chinese medicine makes this boy is alright, but his elbow.
3 weeks ago, this boy broke his arm, a simple accident. The arm should have been set, but the village medicine man, who knows nothing of these things, wrapped it with rotten leaves, expecting this to ease the pain and heal the wound. This is Chinese medicine, which dates back 4,000 years. Its methods are virtually unchanged since the time of Confucius. They rarely work, and all too often its patients become its victims, as in this case. The arm has healed now, but it is slightly deformed.
And I think that now probably healed, like that little girl from Stock Train, have a 3-week-old injury. I tried to fix it, but I could not move it, so I left it alone. She's doing very good now. We'll have to get an X-ray of this baby.
Bác sĩ nó lỏng những cái xương nó lành rồi ha, nhưng mà nó không nằm đúng vị trí ra ha. Bây giờ để bác sĩ cho chụp hình cái tay, chụp hình phần này coi xương nó nằm sao ha.
You tell Father we take X-ray picture of the bone, and then we see what it looked like, and they come back and see us today after the X-ray.
Bây giờ chụp hình xong rồi đợi rửa tim xong ha, rồi anh đợi đó, cầm lại đây bác sĩ coi là coi xương nó nằm sao đó.
The weather in this part of the world is rarely friendly. Its only changes are from the extremes of incessant heat to driving rain that lasts for days and weeks. Shoes are always soaked. Clothes never dry. Mildew gets into everything. You find that the rain you hoped and waited for can be as tiring as the hot sun. In the outlying areas of Kenyang province, not all the people can get to the hospital, so the hospital must come to the people. On this special trip, Jerry Grant is accompanied by Navy nurses Winnie Copeland and Ann Wilson. These trips are part of the Medical Civic Action Program, MedCamp, set up to bring help directly to the people in their own villages. the village of Tu Ba, people have come from miles around to be here when the Americans arrive. The problems here are no different than in the cities. There are only more of them.
Sometimes you have a coffee.
Tell them to take a deep breath.
Thở mạnh lên đi, hít vô thật nhiều cái thở mạnh lên. Đỡ rồi, vậy rồi. Hả?
How long has boy had infection?
Nè, em này bị bao rồi đó chị?
3-4 ngày.
3-4 ngày lên dưới đó hả? 2 days ago rồi.
5 days. Tell this mother that this boy should come to hospital today or tomorrow. We will bring him into hospital. He needs much antibiotics. Let's give him erythromycin. Start him on.
Bây giờ chị có thể cho.
Uống được mà đau sống quá đau được quá.
Uống được không? Ăn ngon không?
Ăn ngon.
This man talk, he is not good appetite and cannot sleep at night.
So let's give him some vitamins for his pain. I think you feel better after you take some vitamins.
Yeah. Cái này nghe uống ngày 3 lần nghe mỗi lần viên nha.
Tell her to wash the baby's head and the sore areas with the Physihex at least twice or 3 times every day.
With water. Use a lot of. This has water in it.
Mỗi lần cái này dùng một ngày 2 lần nha, rửa cái mấy cái một kẻ này nha, ngày 2 nha, no cough.
No cough. But just pain in chest.
Có đau ngực không?
Có, đứng đâu cái nó đau ê. Đau
Feel a
hoài.
little pain in chest.
Okay. Well, why don't we? Which side of chest?
Bên nào, bên phải, bên trái? Bên trái phải, trước một.
Why don't we give her some aspirin for that?
Believe all this? One of the baby's ear. It comes off, but it's just crusted right in there, and it's nothing but the water.
Yeah, cũng như mỗi lần mà có máu rồi. There's an old man, he talk, but sometimes he go bowel movement. He will saw the blood in
He
stool.
has blood in stool.
Yeah.
Okay.
Ăn đồ nóng mà uống được.
If he can come to hospital, we'd like to see him there.
Bây giờ
But we will give him medicine here. If it does not go away after 2 weeks, tell him to come to hospital. Okay?
Nếu trường hợp mà không cho thuốc uống không hết thì đến bệnh viện nha. Sẽ chụp hình rồi sau đó xong nhân luôn nha. Hay đó ha. Với mình trước trường rồi.
Cerebral palsy.
About 1 year.
Tell this baby to come to hospital Wednesday afternoon.
Chị nghe tôi nói nè, bây giờ chị có thể mang em ra nằm bệnh viện đi nha. Thứ Tư á, chiều thứ Tư á. Chiều thứ Tư tuần tới nè. Bệnh viện được giá kìa. 3 năm mấy năm? 4 năm hả? 4 years rồi.
How many?
4 years rồi.
She has. Yeah. Let's take her name down.
Chị nói,
We will try to get her prosthesis for her arm.
Cái gì?
Nguyễn Thị Diệu.
Very well healed.
Bao nhiêu đó? Rất là fan luôn.
Nhiều khi ăn đồ độc.
Well, we tried to get her some help with a new arm.
Làm gì mình
In this climate of incessant heat and stifling humidity, you get tired in minutes instead of hours. At midday, everything stops.
Foxy House. Emergency?
A Viet Cong ambush.
Okay, I come.
5 men severely wounded. Hand grenade. Shrapnel. Intense bleeding. Right arm shattered below the elbow.
Layers and layers and layers of dirt on it. Okay, I guess we can put dry ones in, huh? We get some compressions down here. The most important thing in this is we'll just wash this very clean and then put them into a big splint. Watch them closely. Many problems that arise after these kind of injuries. Afterwards, you frequently have blood loss as a problem. That's some window. It doesn't have to be sterile. Put this right here. Blood roll next does not have to be sterile. Just give me a roll, Coke. Alright. Mrs. Bob, do you have any a towel to cover that with?
Tôi có đem nóng chứ? Nguyện mở thêm Nguyện.
So that we don't put it down in the dirt again. Yeah, let me use a little soap here and wash out this one. You want to cut for a while, we're going to do this right by the seams. We're just about finished with this one.
A casualty of war. The face of a child struggling to survive. That men will give their time, their energy, and their knowledge to help other men. This